presenter today was Rebecca Parton, and she unfortunately had a family emergency, wasn't able to be here, but she went above and beyond and recorded some of her slides for us. So we're going to go ahead and actually play the slides that we have for you as our didactic session. And Holly and Hannah both agreed to be here to answer any questions or provide commentary as appropriate for those as well.
Becky Parton has no conflicts to disclose. This is a training on COVID-19 and the impacts on families. My name is Becky Parton, and I work for Dartmouth Trauma Interventions Research Center. Thanks for having me today. I'm going to start with the initial impacts of the coronavirus. As you can see here, unemployment hit immediately. Job loss was probably the first thing that we all thought about when the coronavirus came out. The industries that were impacted the most were leisure and hospitality. They lost 47% of their jobs nationally in the month of April 2020. A lot of those are food service jobs. Over 5 million chefs, waiters, and cashiers lost their jobs. Healthcare also saw steep job losses, over 1 million, about 1.4 million, and that was partly because of a drop in revenues at hospitals and clinics and having fewer elective and routine procedures. We also saw a lot of job losses for dentists. Most of their offices closed, physicians. We saw other healthcare in general, and we saw a change in childcare services. Those are the biggest industries hit. Because of job losses, there was pretty quickly food insecurity. A lot of the initial job losses were low-wage workers, people who are probably already living paycheck to paycheck. And as time drags on, this is hitting small businesses and white-collar workers as well. Our economy is so intertwined that each industry being closed is impacting other industries. And again, food insecurity was a big thing that we saw early on. Interestingly, many people are just now realizing the connection between affordable, quality, and available childcare and the rest of the economy. Many people lost jobs or started working from home at the same time that childcares were closed. This was an essential link. At first, too many daycares were closing, and the state of New Hampshire had to pull together a task force to make sure there was enough available daycare for essential workers. They actually opened up more spots than are currently being used. For most non-essential employees, daycare was not an option. Parents are having to make tough decisions about juggling work and regular child-caring activities. I've heard many parents say, "I didn't choose to be a stay-at-home parent for a reason." Caring for a child or children full-time is a lot of work. There are constant demands on the caregivers. On a good day, that can be stressful. Now we're adding in the stress of a worldwide pandemic, likely financial stress and strain, worries and fears about personal safety and the safety of our loved ones, and worries about meeting our basic needs. It makes it all hard for parents to continue to be thinking about things like meeting their child's developmental milestones, making sure they're being read to, sung to, and held enough. When we're stressed, we often don't stop to be playful, which is what children need a lot of right now. Parents are often juggling very real stressors, and each moment they're having to decide which is the most important right now. It feels like survival mode for both parents who are unemployed and parents who are still working. I want to distinguish that there is a difference between access to daycare and access to school. As our economy is being pushed to reopen, there is a lot of talk about daycares reopening and making sure those two things coincide. That is definitely important, and I think people who don't have young children forget that elementary school-age children in particular also need constant supervision and care in a slightly different way. If parents are working from home, they're also having to juggle their school-age child's needs. This can range from constant or regular Zoom and video calls with teachers and classmates to worksheets, activities, and assignments. Some schools have provided a lot of structure and ideas for materials. Others are touching base much less regularly. There's an incredible amount of pressure and stress on parents to try to be teachers right now. I've heard parents tell me that they have to have their own one-on-one Zoom call with a teacher to learn how to teach specific math problems. Others have had to take shifts with their partners to manage school work and calls. Some leave their children to do it independently and hope for the best. For older children, there may be more demands. I've heard of students having a virtual version of their high school schedule from 8 to 3. Others are able to do work independently as needed. One thing that has become more obvious is the disparity between households. Well-to-do households that already had access to laptops, internet, and technology seem to have transitioned to remote learning more smoothly. Some school districts were able to send home Chromebooks within the first week of remote learning. Others had to fundraise and were able to get supplies weeks or months in. Still others simply relied on families to supply all the technology at home. Some families live in too remote an area to have consistent phone lines or internet, and some just can't afford it. There are children who are definitely being left behind by this technology and access gap. And lastly, schools were an important lifeline to food access for many children and families. Some children were getting 2 meals a day at school and were bringing home a backpack of food for the weekends. Just generally, parents are saying it feels like their children are eating more, and it's noticeable the amount of food they are going through at home. I know that's how I feel. Some school districts pivoted quickly and organized food baskets or lunches to be picked up or delivered. And a few weeks into the pandemic, the USDA changed its regulations so that schools could allow anyone to qualify for free lunch. So families that may not have previously qualified are now able to have access to this additional food. Many districts are using school buses to deliver food to families or neighborhoods. Some have pickup programs. This has been wonderful to see communities rally together. However, once the school year ends, it is unlikely that these programs will continue, and families will again be faced with food insecurity. On a more global scale, we are starting to see larger, more long-term impacts. Some families are already facing difficulty affording their housing. In New Hampshire, the state of emergency orders prevent landlords from evicting tenants unless there are severe circumstances. However, if the state starts reopening and the state of emergency orders are lifted, there's a possibility that this will be harder to enforce or will not be in place anymore. We continue to see great demand at food banks and food pantries. Even with the economy slowly reopening, this is likely to continue. There's also this general sense of danger in the world. We've been trained to think that the coronavirus could be anywhere, which is true. And in particular, because people are the carriers, other people start to feel unsafe. I've heard coworkers say that they've started to notice an involuntary flinching or even a distrust of other people, but particularly strangers. In some areas, people might cross the street or move far away if they see someone coming. It has also become normal to see people wearing face masks, but it's harder to see if someone is smiling or guess what someone is thinking when you can't see their whole face. There's already a collective grief or a collective trauma experience. We've all lost some sense of normal life. For some, it's birthdays, graduations, proms for high school students. People are being creative and have come up with alternative ways to celebrate and be together. Weddings, funerals, and graduations have been held by Zoom. People are having birthday parades by car. So we're being really creative about this. The last major impact that I've seen on a more global scale is the growing political divide. Even in Concord, New Hampshire, we had protests over people who wanted to have the stay-at-home orders lifted. There are people who don't want to wear masks, and even others who think this is a hoax or not a serious disease. There are continuing growing political tensions in our country, and particularly as we get closer to the general election this November. COVID-19 has made us all experience some version of collective trauma. One of the hallmarks of a traumatic event is that you feel unsafe. Either there was a real or perceived threat of danger, and coronavirus has all made us feel that the world is unsafe. Think back on the last few months. Have you had days where you felt like your brain was foggy and you couldn't think straight? Do you have periods of time where you lose track of what you're doing or goals you've had? Do you have trouble sleeping or nightmares? Have you felt more tired? Do you find you have less patience for your family and friends? If you have kids, are they more irritable? Do you notice them regressing to old behaviors you haven't seen in a long time? Do you miss what life, quote, used to be like? Do you feel angry about something you're missing? Do you feel guilty about the anger you feel for your change in situation? Have you noticed yourself drinking more alcohol or using coping skills that you know aren't healthy? A lot of us have experienced some version of these symptoms. There's already an increased need for mental health services since the coronavirus hit. Initially, many of my colleagues found that there was a drop-off in clients wanting to be seen. In the first few weeks of the pandemic, people weren't sure how long this would last, and their initial thought was to hunker down, to stay home, and be close to family. As time wore on, many people who had already been in therapy started to call back and ask to be seen by telehealth. As even more time has gone on, we've seen an increased need for new services. There's definitely increased anxiety. I would say that's pretty true universally. Most of us are feeling some of that increased anxiety. There are real reasons why people might feel anxious. The world feels unsafe. The stock markets are dropping. There's toilet paper shortages and food shortages. When you see empty grocery store shelves, it's natural to start to feel panicked and to want to buy more of a particular item that seems scarce. Because coronavirus is so easily spread, it isn't safe to be around too many people, new people, or older adults. So all of that is going to lead to increased anxiety. There isn't a lot of data out yet, but there is also likely going to be an increase in depression. Rates in the US have been going up over the past few decades anyway, but large-scale events like this, which have real-life impacts on people's livelihoods and sense of safety, are likely to cause more depression. We are also being forced to stay away from each other and have less social contact. Social contact is one of the main protective factors that staves off depression. Organizations like NAMI have started ad campaigns with slogans like, "It's okay to not be okay," and encouraging people to reach out for help. We know that social isolation plus increased stressors are more likely to lead to a risk for suicide. And lastly, I won't spend too much time on this, but there's also an increased risk for substance misuse. As people are feeling more stress, they turn to coping skills that have worked for them in the past. In our culture, often drinking is promoted as a way to relax and a way to cope with stress. There's a lot of talk on social media about daily drinking and increases in drinking. People joke that there's nothing wrong with having your first glass of wine at 10 a.m. For some people, this can seem humorous and it seems like a good joke. But long-term, there will be consequences if people are encouraged to start drinking early and often. For some people, this will become a habit and possibly an addiction. When the pandemic is over and life is returning back to a semblance of normal, there will be some people who will be able to stop drinking that often, but others who find themselves unable to stop. For people who already struggled with alcohol or drug use, this increased stress will make it harder to stay sober. AA meetings and other supports have moved online, but there are challenges with that. First, having access to the online format is not universal. And second, there are fewer activities that people can use for distraction and fewer social supports you can access outside of these groups. Traditionally with AA, you have a sponsor, you might meet for coffee and go for a walk. In this current climate, it might not be safe to do those alternative activities. There are other barriers as well, but the last I want to mention is that many of the meetings that have moved online are open to the general public. The model of care is drop-in, which means that meetings are open to anyone to attend, which is a good thing to keep doing. There is less anonymity, but there's also a risk of things like Zoom bombing. There have been incidents all over the country of meetings, and in particular AA meetings, being interrupted or hacked into. This can be really upsetting for participants, and it's more likely to increase their risk. The other thing to remember about substance use is that it's often helpful in numbing people out and helping them tolerate difficult situations. Many of us would probably welcome the opportunity to numb out when things are hard, so it makes sense that more people would turn to using substances right now. As I was thinking about this talk, I wanted to give some ideas for how to address the needs that we're seeing in kids and families. I decided to use the Protective Factors framework because it outlines strategies for how to build resiliency in the kids and families we work with. Parental resilience means managing stress and functioning well when faced with challenges, adversity, and trauma. Social connections means having positive relationships that provide emotional, informational, instrumental, and spiritual support. Knowledge of parenting and child development means understanding child development and parenting strategies that support physical, cognitive, language, social, and emotional development. Concrete support in times of need means having access to concrete support and services that address a family's needs and help minimize stress caused by challenges. And social emotional competence of children means having family and child interactions that help children develop the ability to communicate clearly and recognize and regulate their emotions and establish and maintain relationships. Social connections is the second building block of the Protective Factors framework. Traditionally, we think about in-person social connections, so we have to be a little bit more creative right now. Do the parents and children already have established relationships? Those are the easiest to build on. Can they call those people? Can they have video calls with them? Some people are meeting up for walks and staying 6 feet apart. Some are having driveway parties or meeting at a parking lot where they can be together outside from an appropriate distance. Some people are connecting online and playing games or having social events. Some families have also started to establish an inner circle of less than 10 people. Maybe grandparents are allowed to come over and see the children from the distance, or maybe a family unit has determined who can be around and how. It's okay to encourage that as long as they're all being safe about it and continuing to follow CDC guidelines. It's important for parents to continue to have connections with family and friends and other parents. It might also be helpful to ask about their spiritual beliefs and connections. Is there a church they attend? Do they have other built-in systems for support? And lastly, ask parents about humor. Are they able to use humor to connect with others? Are they finding ways to laugh and stay lighthearted? I would say all of these same principles apply to children. It's important for them to feel connected, to maintain friendships, and find ways to connect with peers. Even for young children, they can have phone calls or video calls. It can be helpful to see friendly faces or hear friendly voices. Young children can sing or have someone read them a book over the phone. Older children can play games or have less formal playdates by video. They can send letters, they can do drive-by hellos. There are lots of creative ways for kids to stay connected. It's also really important for kids to play. This is how they make sense of the world. They can use play with each other, with parents, or with their peers. Play is so important right now. If parents are struggling with arguments with their kids, fighting with them, getting kids to comply with schoolwork or chores, it can be helpful to encourage playfulness and humor. If you have to choose between schoolwork and connection, always choose connection. The next area of the protective factors framework is knowledge of parenting and child development. Some parents are experienced and knowledgeable and have a good handle on child development, but that's not always the case. And even experienced parents might wonder, is this behavior normal? Ideally, families have grandparents, aunts, uncles, cousins, siblings they can call and rely on for parenting advice. If they don't have those informal supports, you can supplement it with formal supports. Family resource centers are open and doing virtual home visiting. Families are finding that resource really helpful right now. You can also look at the New Hampshire Children's Trust website if you're not sure where your local family resource center is. Pediatricians' offices are a great support in general, so you may have some in-house supports that you can use. The PCP can reassure families about which behaviors are normal or expected. If you have a social worker on staff, they can provide some behavioral health support or parenting education. Schools and child care centers are natural supports as well. They are already connected to the kids and families. As a parent, I know I'm more likely to open an email from my school than from an agency I don't know, and I've prioritized that communication. So schools can be a good resource for getting out information. Websites like the AAP or apps like Vroom can also be really good resources for parents. It's helpful to talk to parents about what is age appropriate. How should kids be responding right now? It's normal for kids to be regressing. Anxiety in children might come out as anger or aggression. It just doesn't look the same as it does in adults. As a community health worker, you might be the resource that parents need to help make sense of their child's behavior. Concrete support is probably the area that you think of most. Having concrete support in times of need is a hallmark of resilience. This could be connecting with you. It could be referrals to agencies outside of your own. You can ask families questions like, if you needed help, would you know who to call? Is there anything specific you need right now? What are you most worried about? Or what do you need help with? 211 is a good all-around resource. They can direct people to just about any service. Local food pantries are probably going to be used more now than usual. Also, families have struggled with getting through to the unemployment office or getting benefits once they apply, so that's a good contact to have handy. The Family Resource Centers and Parent-Child Centers in Vermont can do a lot of the case management that families need right now. So if it's outside your capacity to help families at that level, the Family Resource Centers are a great referral. And some families will actually need that higher level of care with formal mental health services. Community mental health centers are taking referrals, although there's often a wait list. Private practitioners are also mostly taking new referrals. Some have been hesitant to start with new clients by telehealth, but we are all realizing that this will likely be the case for at least a few more months to come, so a lot of them have come around on that and are taking new cases. The last building block of the protective factors framework is building up the social and emotional competence of children. Just like with adults, you can ask what has worked for you in the past when you felt this way, but some children may not have had as many experiences of competence to draw on, so you can teach coping skills. There are lots of websites and apps that parents and kids can use to learn about mindfulness, meditation, and deep breathing. You can teach these skills over the phone, by video, or again, direct the families to websites and videos. For children of all ages, things like deep breathing and mindfulness activities can help regulate their bodies. We can also encourage social connections with peers. I mentioned this before. Kids can still be connected right now, by video, by phone, by mailing cards and letters. They can sometimes play from a distance. Middle school age kids and teenagers might be able to get together without touching. Teens are probably going to be getting together even if parents don't want them to. And in some ways, maybe that's okay, as long as they're responsible and can minimize the contact and touching and shared items. Parents have really been struggling with this, how to keep their family members safe but still allow teens some freedom. It's a hard balance, so each family really has to figure out what works for them. And lastly, you can all be ambassadors of the message, it's okay to not be okay. May is Mental Health Awareness Month. All of us can encourage taking care of our mental health. NAMI has put out an ad campaign, particularly I've seen it on HBO, but you can see it in other places too, saying, it's okay to not be okay. It's a message we can all share. You might see signs in your community that say, we're all in this together, and that's also a great message to send. We are all collectively experiencing this difficult time. We are all feeling some of these same effects. So we can support each other and be together, even when we're apart. Thank you for listening. I hope you found this helpful and hopeful.
Great. Awesome. I'm so thankful for Becky for taking the time out of her schedule to record that for us. And I'm sorry she couldn't be here, but I hope that you all found some value in that. I thought there were a lot of really good suggestions in there. So I wanted to open up the floor for the participants to share some of their questions or their comments. I see some discussion happening in the chat.
Yeah. Brian, do you want me to start?
Yeah, that'd be great. Thank you, Amber.
Sarah Lawrence, you've put a couple of things into the chat box, and one of them was answered, but do you want to come off of mute and kind of talk about what you said about your son? If you're able to.
Sure. I just thought it was sort of a wonderful instinctive response that to him, it's so clear that this is who knows what is going through his head, but that this is a universal experience and it's okay to not be okay. And my goodness, how could anyone be okay with the extent to which life has been altered and that we are not getting to see our friends and family? I mean, who on earth would be okay? And I just love that instinct in this little boy. And I wish, I wish we all, yes, that's you, Zachary. We all had that. And for anyone who thinks, who's worried that I have him here listening to this, I also went over to him at one point and said to him how thankful I was that he is so wonderful at trying so hard at his distance learning and making it easy for me to guide him, and that it is a joy for me to guide him. But both my kids know that, and we talk about how sometimes we get stressed out and carpet each other or lose patience, and that is okay. What's that? So I just want you all to know that we keep a constant dialogue in our house. Not constant, but we attend to sort of the mood changes, and we put it in the context all the time of this is a hard thing to get through. So I will put myself back on mute now.
It is a hard thing to get through, Sarah. Thank you for sharing that. It's always interesting to hear the kids' take on it. So thank you. Does anyone else have anything that they want to add to what Sarah has said or anything on the presentation?
Thanks, Amber. It looks like looks like my Zoom decided to quit there for a second. I just wanted to say something that Sarah said reminded me of something that was mentioned in the presentation, and you know, everyone really is dealing with this pandemic in some way. So the question, who is okay? It's so very true because we're all dealing with it, and I think it's important to remember that, absolutely. But something Becky mentioned in her presentation was that the unemployment levels, you know, first it started to affect, you know, the food industry and hospitality industry, but then it did have effects in other positions that are traditionally considered to be more stable. So I think that it really shows that the social and the economic hardships that people are experiencing right now, it's not limited to any one certain group, and everyone really is dealing with it in their, you know, in however different ways, right? So I think that's important to remember, especially when when thinking about where your referrals are coming from or the questions that you're asking people. I think it's important to normalize asking some of these questions about how you might have been affected by this, or just saying, you know, a lot of people are experiencing some of these hardships, and are you having a hard time with, you know, accessing food or any of these other resources that might be available to you, even if, you know, that person was a dentist or a dental hygienist. Yeah, I think that's important to remember. Looks like we have a comment here from John.
Yeah, John, do you want to come off of mute and kind of talk about that?
Yeah, I was just looking at, I mean, my wife is a provider. She's a physician assistant. And I actually did a little help with the local hospital here, helping roll out some telehealth training for their different offices, because I had worked there previously in their education center. So they'd asked me to come and assist. But I think it's one of those things, you know, this is an illness. Why are the medical fields being affected? And we forget that it's a much bigger thing, and that, you know, it's a place that we feel that we want to go, but they had to look at, you know, they weren't doing surgeries, they weren't doing regular appointments, behavioral health switched to telehealth. There was, you know, and so I think that also causes an anxiety, because you call to talk to your doctor and they say, well, you can't talk to us, you have to call this number. Are you having a cough? Have you traveled? Well, if you've done that, now you need to go here and you need to call this person. So even the normalcy and the you know, the normalcy you had in your medical care changed. So it wasn't just being faced with an illness, but you were also being faced with not even knowing how to maybe contact your provider with a question, or being afraid to contact your provider with a question, or be afraid to go in and get a regular test or treatment that you still needed to have even though COVID was going on.
Thanks, John. It's absolutely true. Hannah and Holly, anything to share around that?
Yeah, I think there's so much that we could take this in so many different directions. You know, I think going off of the last comment and, you know, the populations that you're seeing right now, speaking a little bit about what Brian was leading into, and thinking about, you know, some of the clients or the referrals that you've, you know, been getting over the last month or so, and how some of them may have never needed to ask for help before, may have never found them in this situation, may feel extreme vulnerability, might have challenges navigating the system, might have a lot of emotions around this, as well as individuals that may not have been anxious in the past, or struggled with depression or substance, you know, misuse and things like that. And I think just opening up the question around, you know, what are you seeing in a change in your populations, and how is that sort of changing and shifting your work? Maybe what are you thankful for that you received training on, or you know, projects like this Project Echo, where you can connect with other individuals to gain resources and expertise in a pretty fast moving environment. So I think I have a lot of questions for this group in just terms of thinking about how things have changed for you and your work, and, you know, what are you seeing differently, would be sort of my question.
Thanks, Holly. That's a really good point. And the chat box is open for people to add their input there. You're also welcome to come off mute. when thinking about, you know, kids and how this is affecting them, I know some conversations that have been happening are around summer programs as well. So I know some of the community health workers that I've worked with, part of their role is helping families get connected to summer programs for their kids. And I think that some of those programs are going to be affected. And it will be interesting to see how that plays out as well.
And
Before,
Brian, to
yep,
that comment, one of the cases that we've reviewed in the past is, some programs definitely offer summer camp vouchers, but then there's all these other layers of challenges for families to navigate actually getting their child there. So are summer camps offering half day versus full day? Are there meals provided? What about the transportation, especially if buses aren't running? And so while we know that children should be in programming and with their peers and getting all of that social, emotional, and physical well-being, what are some of the navigation steps that are going to either, make that happen or not? And then going back to this, disparity question in is this equitable across all of our regions and our towns, especially with some of the unknown that is happening. Some towns, the pools are opening, and some towns they're not. Some towns, the summer camps are opening, and in some towns they're not. So it can be really disheartening and challenging for families to navigate that.
thanks, Holly. And I'm really interested to hear from all of the participants if you all have been experiencing or have witnessed any of these, difficulties. If you work with families, or even if you don't work with families, have you experienced that any of your clients have had added stress about COVID, or just their general stress levels have been even greater because of COVID? And if you're willing to share that, that would be really greatly appreciated.
Hey, Jen Glay, I see you put something in the chat box. Are you able to come off of mute and share?
Hey, Amber, can everyone hear me?
Yep.
Okay, so I am just curious. Within our program, we receive a lot of referrals for families who have children who are currently in the foster care system or with families. And we're seeing a lot of challenges right now for those families who are, say, 3 months in or 6 months in, and the last thing they need to achieve is housing. And right now we're seeing a stall on a lot of those pieces. I'm just wondering if anybody has any strategies or ways that they're navigating that system right now to have best outcomes.
Thank you, Jen. Does anyone have anything to offer? So from Carrie Leahy, I'll read it out. She can't come off of mute. So I don't think this is related to you, Jen. It's a different comment, but Carrie says, speaking for my own stress level, not having an answer about day camp guidance and having to come back to work full time when remote learning ends in 2 weeks, what are families supposed to do? Our normal daycare canceled 3 weeks ago, and she knows this is a common stressor amongst many folks. So. Holly, did you? Yeah.
Yeah, and the guidelines are coming out from, the different states, just in response to Carrie's comment that, they'll be operating at less capacity. And so the likelihood that camps will be filling up is really high. And so, it presents less options for families. And there's no sort of stratification that I've seen that's come out like that you definitely require it or you need it. And so, right, it goes back to this equity piece around, are parents just, able to afford and put their child in, hold in a summer camp spot versus the parents that are working and actually, also need it for childcare and safety of their child. There several years ago, like 30, 40 years ago, there was sort of this close the door, lock the key movement that went forward with young children. And, you know, there's definitely some concern with some of these barriers, Carrie, that you're mentioning, that we could go back to that, and how scary that would be today to be going back to that kind of a community environment. So parents are having to choose to return to work or not return to work based on, you know, the safety of their children, and it's a real struggle.
Another comment came in from someone who can't come off of me. So Carol Sarazin says, for my patients, a big stressor is not being able to bring their children with them to their needed in-house appointments with no support to take care of their children.
And I'll just echo that, you know, all of these experiences that people are talking about is really highlighting the parent stress and anxiety that parents are having. And we know that when parents and caregivers are stressed, right, children can feel those effects, you know, secondhand for sure. And so how are individuals helping to coach their clients and their patient panel on coping strategies and de-stressing, especially during these times of heightened anxiety? And again, back to my comment that some folks may never have had to develop those skills, had the resources to develop those skills, but it's such a critical piece in thinking about the protective factors of children, that we're managing our own well-being as adults, right? Especially those of us who are either taking care of children or have children, so that we are helping children to develop those skills early on.
Holly, I think that's a really good point. And this sort of goes back to the comment about housing as well. You know, right now, housing is always difficult, right? It's we have very limited supplies and things like that. But especially right now, a lot of these resources that as a community we really rely on, they're either changing or have different capacity, or you know, they're able to assist fewer people. And you make a really great point that sometimes it's not about, you know, you do what you can to connect to the resource, but then if the resource isn't there, you do what you can to help the person cope and still overcome that barrier. So that's a really, really good point, Holly. All right, so I do want to give an opportunity from the other panel members to provide any insight that they have around, I see some other comments coming in, but quickly just around the presentation. Any thoughts from the rest of the panel members?
Brian, I just wanted to jump in and I think highlight one of the comments that Holly had made as well. Just really trying to navigate folks to our family resource centers throughout the state. I think when parents and families are experiencing this high level of stress, it can be sometimes difficult to organize and navigate those natural supports that they might have. And family resource centers are really skilled in helping families to identify and organize those thoughts and be able to put them into practice. So I can't state how important those resources are in our community, especially during a time like this. Though they may be meeting with people in different capacities than typically seen, still a wealth of information, and then can be found online and through 211, finding your local family resource center for patients in your area or clients.
Right, and I just really quickly wanted to also connect something that Holly just said back to Jennifer's question about DCYF. So Holly said, when the resource isn't there, you just have to help the family cope. So unfortunately, Jennifer's comment was about kiddos that are in DCYF custody, and all the parent needs is to get housing to get their kiddos back. And I think on the professional side of it, when we are working with the families, all we can do is try to help coordinate that communication with DCYF and keep those lines of communication open and flowing, and seeing what we can do to support the family from our end with these kind of hurdles as well. But with housing resources kind of at a standstill right now, I think it goes back to what Holly said, when the resource isn't there, we just have to help them cope. We have to be the person that the family can go to and vent to and really feel supported by, while also continuing ourselves to communicate with DCYF, let them know the parents are still trying. They're trying their best and they really want their kids back, but just the situation is kind of making things stall out, unfortunately.
Thank you, Hannah. Yeah, that's so important. And I'm glad that you pointed that out for us. Amber, what's going on in the chat?
Some great conversation. So there's a couple I'm going to read out because I know Carrie's in the office and had previously said she couldn't come off of mute. So Carrie had said that she thinks this is a good opportunity for more employers to begin offering childcare. As advocates for change, perhaps that maybe we should start with our own employers if it's not currently offered. She says this has highlighted that particular need in a time of crisis. And then there was something that Charlie put into the chat. I don't know if Charlie's able to come off of mute. I saw him a minute ago.
Yes, I can. You hear me?
Yes.
Yeah, so I think, with DCYF right now, with just working with them, they're really short staffed. They're in a major trying to hire people right now because they know it. And I think when it comes to working with their resources in that, they're just so very busy trying to contact the educators to see if the kids are showing up where it's all the virtual learning now. And it's just the reported cases for, the abuse and neglect are so low that they're really nervous of what's going on with the kids.
For sure. And then there was a comment back to that from Carrie saying that she agreed when you look at the normal call volumes to report a suspected case, there's been a decrease. And this is troublesome with kids not having the contact of school coaches from sports that would often do the reporting. So we've all seen that as we've seen it in the news, and it's definitely an issue right now. Coming back up, John, you dropped another comment in the chat. Would you be willing to come up and talk about that?
Sure. It's just something that I've been noticing, since the weather's been changing and being a parent, although my kids are older, right? There's a lot of challenges just having children and trying to keep them on the right path. So I've noticed a lot more activity by kids now that it's gotten warmer and you can go by the park. And even though the parks are closed, the kids are starting to gather in groups or playing football or playing, soccer, riding bikes. So it's another balance I think you have as a parent. So to go back to what the discussion earlier about someone that talked about their 5-year-old and working on social distancing. So we can tell our kids, we want you to social distance. Don't forget, you need to wear a mask or whatever. But when kids get outside, the focus is playing. The focus is not safety. Because if it was, you wouldn't have all these little kids going to the hospital with cuts and bruises and broken wrists because they tried something ridiculous, right? So, and how do you balance that as a parent who's trying to be diligent versus a parent who's not, right? So a parent who says, yeah, if one family's not wearing masks and your family's wearing masks, do you tell your kids, well, sorry, you can't play with that kid. I know they're your best friend, but if they're not going to wear a mask, you're not going to play with them. I think if you're a parent, every parent here has had their child, if they're old enough, tell them they hate them at some point in time for not letting them do what they want to do, right? So I think this is just another part of it. It's the home part of it, and now school's going to end, and the summer's beginning, and it's warm, and people are starting to gather. Yeah, that was it.
Definitely. So I'm trying to capture all the chat, but everyone just kind of read through the chat just to make sure that I didn't miss anything because there's some great comments coming in. Jessalyn, are you able to come off of mute and share?
Yeah, I think the unique thing that I'm seeing with some of my patients that I work with is the age group I work with are typically grandparent age, and many of them have some sort of role in childcare, either closing the gap for after school care or for their kids who work night shifts. And they're really feeling some conflict with being a high risk population and yet really wanting to help their children by watching grandchildren, so that their kids can go back to work. And and I had one woman who shared with me, well, I don't know who my grandchild is exposed to when he's at his mom's house, or who his mom might be exposed to when she's at work, but she has no other option for childcare other than me. So that's a conflict that, I've heard in two circumstances that, it's just kind of a new challenge. These grandparents who are typically helping out in some capacity. So.
Absolutely, thank you. Brian, I don't know how much time we have left for comments.
I think we have a couple more minutes. I did see a comment from Sarah Lawrence that I thought it would be interesting to get to. It was a question.
Yes, absolutely. So Sarah, do you want to come off and share and ask that question? Are you able to come off of mute, Sarah Lawrence? Oh, okay. So she says her son's listening to a video about Yellowstone, so that remote learning. So I'll go up and I'll read Sarah's comment. So she said, regarding rapport building, which was a comment from Holly. Holly had said, it is that therapeutic relationship that all of you are so good at creating, building, and fostering. Rapport building is so critical, which it absolutely is. And in regards to that, Sarah had said, can we hear from the experts some guidance as CHWs might feel a need to push the envelope open wider in terms of professional boundaries, to share what they are going through on a personal level in order to more authentically empathize with the client? Maybe just an awareness that they will be more inclined to share, and to keep in mind a balance of the need to stay professional and relate as a human being. Boundaries are tricky anyways, and so when you add this extra stressor, for sure. Anyone on our panel have anything to comment on that? Not that we're necessarily the experts, but we'll start there.
Hannah, do you have anything, or want me to go ahead?
You can go first and then I can chime in, Holly.
Yeah, so I think it's a great question. I think it's I think all of us have learned a little bit more about each other's home and personal lives with our professional colleagues, right, than we probably ever have before, and maybe with some of our clients or patients that we serve. So I think just a few guiding principles to think about is, making sure that sort of any relatable maybe advice that you might have used yourself and then that you might be passing off is, evidence informed, that it's not just, opinion based, that it's something that you would recommend, professionally. The other thing is maintaining confidentiality around, yourself and anyone that's close to you is really important. And I think all of us at some point can relate to other people, and that sort of goes into that peer support piece. So I think maintaining boundaries is really critical, especially any of us working in the medical, mental health field, especially, and also continuing to make sure that your boundaries fit within your professional code of responsibility with whatever role you have. Social media policies with patients and families, outside hours, making sure that you stay within all of those professional boundaries. But I think relating sort of generally, like, yeah, parenting is hard. And here are some of the, evidence-informed strategies. You wouldn't use that terminology, but here are some of the strategies that I've definitely found. Making sure that you keep it professional while also having some relatable undertone would be my guidance that I would give.
I was going to speak to the same effect of that. I think it's it's great to share bits and pieces as long as the larger overall message is that you're sharing this as a support. So like Holly said, as a parent, I totally feel that. And these are the things that I've done in the past. You're bringing in some personal aspects of it, but you're still keeping it professional. You're still keeping the goal as supporting this family. I think the thing that I always go back to when I'm thinking about sharing anything with a family is to ask myself, if I share X, Y, and Z, what are those things going to change for that mom? You know, having that really specific information, is that really going to change the way she is communicating with me or the way she's thinking about the situation? If yes, maybe you do move forward very delicately and share some of those things. But if it's not the really specific information that's going to change your relationship or change the information you're trying to get through, try to just kind of package it up a little neater and not go so much in depth.
Thank you. I'm not sure if anyone else has anything to add to that. There's a lot of stuff in the chat going on. If you missed it, Megan had dropped a question in saying, life after COVID, what questions do you have that you would like answered? Or what topics specifically are you looking to learn more about? So if you missed that in the chat, feel free to drop that in. Trying to see if there's, Brian, do we want to do a wrap up now or?
Yeah. I mean, I guess my last comment, if there are no comments from anyone else, when I think about maintaining professional boundaries, it always makes me go to the benefit of maintaining professional boundaries for your patient or your client, but also for yourself as well. And, you know, talking about stress and anxiety, and as a CHW, sometimes being that one connection that people have or that social connection for them. You talk about a lot of heavy things, and I just want to put a reminder out there to everyone to always remember your own personal self-care and your own personal mental health as well, especially right now. We're all going through some of these really difficult times. So just wanted to put that plug out there for everyone as well, because I think it's super important, especially for folks in your role doing the type of work that you're doing, which is so appreciated right now, and I think very needed at this time as well. So I just wanted to put that out there. So I'm going to turn it over to Lindsay quickly to give us a quick summary of the different topics that we talked about and the recommendations that we talked about as well. Lindsay, are you able to come off mute and do that for us?
Sure. Yeah, we've covered a lot during this session. So really, we've started out with addressing family anxiety, you know, around unemployment and things changing within their healthcare system, and really moved through some strategies for supporting those families and caregivers. So that's all going to be outlined in our notes. I think there's been some really great discussion and supports from Holly and Hannah that we've hopefully outlined within these notes as well, and hope to be able to reflect those for you.
Thank you so much, Lindsay. All right, everyone, I think that pretty much wraps up our agenda for today.